My name's Heather Jackson. I'm a physiotherapist by background and I currently work as a clinical lead for Doncaster and Bassetlaw Teaching Hospitals. I lead our physiotherapy practitioner services and our MSK physiotherapy service. In addition to the clinical lead role, I'm also seconded to the primary care workforce and training hub for South Yorkshire and Bassetlaw, where I am the MSK first contact practitioner lead, and I also am an advisor for advanced practice roles linked to primary care. Before I even started training, I only had two criteria for a job. One was to work with people and one was to be able to help people. They were my two criteria, and it did feel a little bit like I fell into physiotherapy, probably because I was fairly good at biology and also my aunt was a physiotherapist. And so when I started my training at Coventry in 1990, I still wasn't 100% sure physiotherapy was what I wanted. But actually I was very fortunate to work with some really super clinical supervisors who were really encouraging and really helped me sort of reach my sort of level from a physiotherapy perspective. Qualified in 1993, and quite early on in my career I specialised in MSK adult outpatients. Probably from the perspective of MSK, I decided on that because it has such a broad experience from a portfolio career perspective, and I liked the variety that it brought with it. And in 1997 I decided I wanted to go on to do my masters. And in part that was because in clinical practice I had lots of questions of which I didn't have answers, and I thought the master's degree would be a good way of finding out those answers. What I actually ended up with were more questions than answers, but what the masters offered me was an opportunity to develop my critical thinking, particularly in undifferentiated scenarios. So where really there wasn't a clear-cut path, actually developing critical thinking helped me to just work my way through things. And I think that was probably the start of my developing drive, if you like, to develop into an advanced practice role. So in 2000 I was fortunate enough to get a role as a physiotherapy practitioner here at the organisation. In those days we were known as extended scope physiotherapists, we're now known as advanced practice physiotherapists, and had a great opportunity to work with a lot of trauma and orthopaedic consultants and GPs with special interest in musculoskeletal, and they really helped me hone my clinical skills. And it became probably clear to me as my career went on that as well as the clinical skills, I enjoyed leading. I liked having an opportunity to be able to influence services, act on outcomes of audits, and I was also blessed really to have a line manager who was very happy and willing to let me take forward some of those leadership opportunities. So I led within our practitioner team as a governance lead, and then in 2012, after a couple of children along the way as well, had an opportunity to apply for the clinical lead role, and I was successful in that. And that for me is really where leadership has massively taken off. So having the responsibility for leading a service, being accountable to that service, being able to lead teams on a direction was something that I've really sort of thrived on. And it became clear being in that leadership role, particularly leading senior clinical members of staff within the organisation, that I would benefit from framework in terms of leadership training. So in 2015, having probably badgered my line manager to death, I finally got onto the Mary Seacole leadership programme through the NHS Leadership Academy, and that was just a great opportunity really to develop a framework as a leader within healthcare, and some of the things that I learned from that I continue to use every day now. So going on from there, that sort of then helped me in terms of developing our workforce further. And in 2017, I was very fortunate to have been nominated for a national award, the Chief Allied Health Professions Officers Award for Workforce Development. And also within our own organisation, I was nominated for an Improvement Award linked to the work I'd done within the service. And not being somebody who wanted to sort of stagnate or stand still, or perhaps I just like the ongoing challenge. In 2018, I had an opportunity to undertake a piece of work for the integrated care system across South Yorkshire and Bassetlaw around the MSK first contact roles in primary care, which was very well received. And it is from that it led on to my ongoing secondment with the primary care workforce. I would say from a challenge perspective, being a physiotherapist 20 years ago, moving into the extended scope role, which was a role you were seeing patients that otherwise would have seen a medical member of staff. I guess you can understand that would have taken a lot of time to build credibility amongst colleagues, and not just amongst medical colleagues either, actually amongst peers as well. And with that, I think just being able to demonstrate the impact that the role has, and how an allied health professional sitting in a seat that otherwise a medical member of staff would have been, in terms of that holistic view of a patient. It took some time to really be able to demonstrate the true impact of it from a patient and from a service perspective. So that's probably been one of the biggest challenges, and I'm very pleased to say that actually as time has gone on and they're much more established roles now, that I wouldn't say it's never there, but it's certainly a lot less than it was. I think I probably have been guilty of thinking I've been lucky and I've just sort of fallen into these opportunities, but actually what you realise is that you haven't, and there is a great deal of opportunity within the profession to be able to develop both as a clinician and as a leader, which has been probably the thing that has kept me working in the health service after what is now 27 years, and still planning to stay for maybe not another 27 years, but a few more years yet from that perspective. And certainly from a gains perspective, obviously there's gains in terms of how you've moved up from a pay scale perspective, but in terms of my overall confidence, I think that's had quite a massive impact, because although I may not necessarily come across as not being that confident, I can assure you when I started out as a junior physiotherapist, I absolutely was not. So I think again it just can show how you can gain from a personal perspective. I think the first thing that I would say is anyone can lead. I don't mean that sort of flippantly. I just mean everybody should have an opportunity to lead, and to not, if you do have some reservations, and I was somebody who had some reservations about how I was this the right thing for me, actually just take the leap, and just be prepared to be pushed outside of your comfort zone. Because I think by pushing yourself outside of your comfort zone, you'll only then truly realise probably what you're capable of. I think what also helped me was having sort of line managers and other leaders who were prepared to support me. Nobody always gets it right, but don't be afraid of that. The other thing for me was gaining some formal leadership training, because that provides a framework really on which you can move forward, and it doesn't have to be high flying to begin with. There are lots of leadership courses out there that people can embark on and look to develop their own skills. I think for me, looking forward as both a profession and as AHPs, I would really like to see consultant, non-medical consultant roles being accepted and received in the same way as our medical consultant roles are. I think fundamentally we've seen the merits that these roles can bring from an advanced practice perspective, and I think the consultant roles can only strengthen really the workforce in the health service. Happy AHP Day, and just remember, we're stronger together.